Case number 12, you have a slide from a surgical resection of a 10 centimeter tumor developed in a male patient, 55-year-old, and he consulted for abdominal discomfort, and he came from the east of France. That should maybe give you an idea or a hint to make your diagnosis. You have here the slide of the surgical resection of this lesion. You have here the non-tumor liver. You can see even the ink that was put on the surgical margin. And you have here this lesion that looks eosinophilic at low magnification. You can see that there is no fibrous capsule, and there are several structures here, and here that look eosinophilic and membranous. So we will go at low magnification to see how they look like. You have here this lamellar material. When you go to other places, you still find this kind of material, eosinophilic material. At the border, you even have some kind of granulomatous reaction, macrophagic reaction around this material, eosinophilic material. Also here, some granulomas. Also here, sorry, it's kind of blurry. Must have been a problem with this part of the slide. You have better aspect elsewhere. We go check another section of the slide. Hope it's better. Yes, here. Some granulomatous reaction, eosinophilic material. And what can you do to further confirm your diagnosis is particular staining, Schiff acid periodic staining. So we'll check this special staining together. It was not included in the seminar. It was on purpose. The important thing is to think to order the staining, and it's really nice staining. You can see at low magnification that all these membranous structures are staining positive. Here, strongly positive, and again the granulomatous macrophagic reaction around these structures. So this particular appearance is suggestive of the diagnosis of Echinococcus multilocularis. You know, it's a kind of hydatid disease. Hydatid disease may be caused by the larval forms of the Echinococcus tapeworms. The most frequent is Echinococcus granulosus, that is found in jackals or dogs in all the continents. And there is a less common variant that is due to Echinococcus multilocularis that occur in Eastern Europe, also in some Russian states and Turkey, in the US and in Canada. The definitive host of Echinococcus multilocularis is the fox. And in France, we have some patients, especially in the east of France, that may get infected. So it's quite an aggressive disease, because if it's left untreated, the lesion grows bigger and bigger, go to the peritoneum, and it's lethal in 80% of the case. So there are particular board for this kind of disease. It's like a tumor board. You have to do a big excision with good surgical margin to be sure to not let any of the lesion in the patient because it can recur. And there have been some reports of patients that even under wet liver transplantation for this disease. So it's quite rare. I maybe saw 3 or 4 cases, but it really has a typical appearance that is different from the lesion that we saw that is due to Echinococcus granulosus. And with the Schiff acid stain, it really highlights all these structures of Echinococcus multilocularis.